Hello and welcome to SIU View Only TouchWorks training. In order to access TouchWorks, you will need to log on to the Citrix app page, and you should have been given a Citrix login and password from the IT Service tab. To access this page, please navigate to apps.siumed.edu. Once you have navigated here to launch TouchWorks, you will simply click on the icon. And wait for it to load. Once the application has launched, we will enter our username and password. Please remember that the username is always in all capital letters. Once you have entered this information, please press enter. We are now inside of the application, and depending on your access, you may have different options within TouchWorks. Due to view-only access, we are not going to need the clinical toolbar, so we can go ahead and click out of this. We are now at the daily schedule. To access a provider, you can use your drop-down or simply search a provider's name by using the magnifying glass, selecting the provider, and hitting OK. We can access the provider schedule by using the calendar date or the daily options here. Hitting today will always bring us back to today's schedule. The clinical desktop is where we will go next. This is what contains the bulk of the patient's chart. And to access the clinical desktop, we must have a patient in contacts. There are many ways to access or search for a patient. We can search by MRN, date of birth, or name. We do not recommend searching by barcode, other, phone number, or social security number, as those will pull up Memorial or Springfield Clinic patients. Please just enter the patient's name and hit search, and this will pull up all patients in the queue. And to access the patient, you can simply double click, and this will take us to their clinical desktop. We are now in the chart viewer. The chart viewer is going to contain all the notes as well as results. To access a note, we can simply click and hit view at the bottom, or you can double click and open the note. To close the note, simply hit close or the X in the top right corner. We are able to sort chart viewer by section, owner, encounter, section by subsection, by provider, etc. We can also search using this magnifying glass if you are looking for a specific note or a specific provider's information. The next tab is the Allergies tab. This contains all of the patient's medication and non-medication allergies. You see here, all is defaulted, that you have the option to search by medications or non-medications, and we can search by urgency, type, or category. To view more details about the allergy, simply double click and that will take you to the allergy details screen. Our next tab is medications, very similar to the allergies. We are defaulted to current medications that can sort by past medication, all medication and orders, or all meds. To get additional details about the medication, we can simply click the plus sign next to the medicine, or again by double clicking and opening the details screen. The next tab is the Orders tab. This is where all of the patient's current or past orders live. Again, for more details about the order, simply click the plus sign or double click to bring the details screen up. The view only, we will not use the work list, so we will skip over that to the Privacy tab. The Privacy tab is where any advanced directives or other privacy documents will live. Simply double clicking like the note will bring the document into context. Next is the other side of the screen. We have the health management plan. So we have health management that contains patient's orders, just some helpful information of when the last test was done, etc. Reminders, so any reminders that are set for the patient to have a follow-up test or exam completed. Immunization series, this is where you can find any immunization that was done for the patient. And for additional details, just double click and that will bring up the details screen. Flow sheets, we can specify the flow sheet by the department.